Hello, my name is Shannon Lawrence and I'm a physical therapist here at WVU Medicine. We want to welcome you to the Center for Joint Replacement. This is our pre-op education class leading up to your total hip and total knee replacement. We want you to know that we have been designated by the Joint Commission as an advanced certified center for total hip and total knee replacement. We were the first advanced certified center in the state of West Virginia. We thank you for choosing us for your care. So during this class, we'll discuss how to get ready for surgery, how to get your home ready for when you're discharged, how your course of therapy is going to go. And then Cindy Drummond is going to join us and she's going to discuss recognizing and preventing complications and all the ways you can get a hold of her if you need something between now and after surgery. When you come back for your clinic visits, you will meet with care management and then have your visits with the medical team and then also with your surgical team. We talk about finding someone to be your coach, a friend, a family member, someone who's going to go through this with you. Everything that we talk about today is going to be in your playbook, which you either received at a previous visit with your surgeon or you will receive when you return to the clinic for your history and physical visit. We'll start talking about discharge planning today. So what happens when you're ready to discharge from the hospital? Most of our patients go home. There are times though when you may not be getting around well enough that we think that home is safe, or there's not enough help around that we think that it'll be safe. In those cases, the alternative to home would be a short stay at an inpatient rehab center or skilled nursing facility. Today is about talking about your options and get you thinking about things, but nothing is set in stone today. We'll finalize discharge plans when we see how you're doing after surgery. We talk about setting some realistic goals. What are those activities that you can't enjoy or participate in because of the pain or difficulty you're having in your bad joint? We hear good things. People want to be outdoors and enjoy outdoor activities. Going hunting, fishing, hiking, riding bikes, working in the yard, being able to travel or go shopping. So think about what your goals are because you'll be asked about those along the way. To get your home ready, we'd like you to take a look around. Make sure you have nice clear pathways where you need to be, to the bedroom, to the bathroom, to the living room. Are there throw rugs down? Is there clutter in the way? Is there anything sitting around that could cause you to trip and fall? Let's get your home ready before you come back in for surgery. If you're someone who gets up in the middle of the night, you may think about slipping in a nightlight. People don't usually turn on a light at night. They get up and fumble around in the dark. You're at a little higher risk of falling as you're recovering from your joint replacement, so anything we can do to keep you safe. We may recommend a raised toilet seat, and we may also recommend a shower chair. And then look at the furniture that you sit on at home. If it sits low, if you're having a hard time getting up and down, if you add an extra pillow or a cushion, raise that seat height up a little bit. That can make it easier for you to get up and down. So just some things to think about for home. And a little bit about nutrition. We sometimes don't think about how this impacts recovery, but good nutrition is essential to your recovery. You want to make sure you're getting those proteins and nutrients that your body needs to heal. We recommend a nice, well-balanced diet, fruits and vegetables, lean meats and proteins, avoiding things that aren't so healthy for us, particularly if you're diabetic. You really need good control of your blood sugars for your body to heal, and we don't want you to drink alcohol while you're taking pain medicine. Getting medically ready, we'd like you to stop smoking if you're a smoker. Smoking slows down the healing process, so that covers cigarettes and cigars. And we also want you to stop using nicotine. So that's going to include chewing tobacco, the e-cigarette or vape. Nicotine has the potential to prevent bone healing. So it could keep the bones from growing into those implant pieces and making sure that you completely heal from your surgery. That in turn could decrease the life of your joint replacement. Let us know if you have a change in your health between now and surgery. So if you get a cold or the flu or test positive for COVID, give us a call and let us know. We want you to be at your medical best for surgery and recovery. Some of these things can increase your risk of infection after surgery. We'll have you stop taking medicine that thins your blood. There's a list in the front pocket of your book. That list is also going to be on a slide that will show up here in a few minutes. And if you develop any other infections, bladder infection, kidney infection, if you have teeth that are abscessed and need to be looked at before surgery. So again, we want you to be at your medical best for surgery and recovery. We take that risk of infection after surgery very serious. We really want to get that risk down to as low as we can possibly get it. When you come in for your history and physical visits, they're going to ask you about some allergies, and we want to know about your food and medicine allergies. But your new joint will have metal, plastic, and acrylic in it. They're going to ask about allergies to those things. They'll ask you about a latex allergy, and they'll ask you about a penicillin allergy as well. Here's the list of blood thinners. Now, this is not all of them, but some of the more common ones that we see, and you'll notice the over-the-counter medicines are on here. When you come in for your history and physical visits, they're going to go over everything you take. They'll review your prescription medicine list, anything over the counter that you're taking, or if you're taking any vitamins or supplements, and you'll have in writing how to manage your medications leading up to surgery. Getting physically ready, there's an exercise program in your book under the pre-op checklist tab. Some things we'd like you to get started on leading up to surgery. Some of the research is showing if you can gain some strength before surgery, it can have an impact on your recovery. We're also going to do some of those same exercises after surgery. So if you're working on them, they're a little easier to get restarted. We do have a website, and you can get to the Joint Center website from the WVU Medicine website. You just have to click a little bit to get to orthopedics and then over to the Joint Center page. Or if you do an internet search on WVU Orthopedics Joint, that'll take you to the Joint Center page as well. Hi. My name is Shannon and this is Heath, and we are physical therapists here at WVU Medicine's J.W. Ruby Memorial Hospital. We are going to demonstrate some exercises for you to begin leading up to your total joint replacement. If any of the exercises cause an increase in pain, please avoid that exercise. If you have any questions, please contact your physician or the nurse clinician at the Center for Joint Replacement at WVU Medicine. For this exercise, you're going to pull your toes up as far as you can comfortably and then point them down as far as you can comfortably. You'll perform this exercise 10 to 20 times and complete this 1 to 2 times a day. For this exercise, you're going to tighten the muscles up on your thigh and hold it for a nice slow 5 count, and then you'll relax. You'll complete this exercise 10 to 20 times and perform these 1 to 2 times a day. This exercise is for your buttock. You're going to squeeze your cheeks together, hold for a slow 3 count, and relax. You'll complete this exercise 10 to 20 times and perform once or twice a day. For this exercise, you're going to bend your non-operative leg up onto the bed, and you're going to raise your operative leg or preoperative leg straight up off the bed, pause at the top, and then lower back down. You don't have to raise your leg any higher than your bent knee. You'll perform this exercise 10 to 20 times, 1 to 2 times a day. For this exercise, you're going to bend your operative or preoperative knee up onto the bed and then lower it back down. You want to try to maintain contact with the bed with your heel, and you'll perform this exercise 10 to 20 times, 1 to 2 times per day. This exercise is to strengthen your arms to assist with walking with a walker. You'll need a straight chair with sturdy armrests. You'll sit in the chair, and then you'll raise your bottom up off of the chair with your arms and lower back down. You can use your legs to assist as needed. You'll complete this exercise 10 to 20 times and perform 1 to 2 times per day. So right before surgery, you'll get a call from the hospital on the last business day before your surgery, and they'll call you between 2 and 5 p.m. They'll give you your surgical time and then your arrival time at the hospital. It's the last business day before, because if your surgery's on a Monday, the last business day is Friday. If your surgery's on a Friday, the last business day is Thursday. When they call you on that last business day before, they'll also let you know what time to stop eating and drinking. Currently, the guideline is nothing to eat 8 hours prior to your arrival. You can continue to drink clear liquids up until 2 hours before your arrival. We just ask that you not drink anything that has a red, purple, or blue color to it. We don't want you to chew gum, smoke, use tobacco, or any forms of nicotine during this period of time. At your history and physical visits, you will receive your bottle of HibaCleanse soap, and they'll go over the instructions for that. We talked about letting us know if you have a change in health between now and surgery, but we also want you to protect the skin around that joint that we're going to replace. Keep it clear of cuts and scrapes and rashes. Your surgeon is not going to want to do an incision up through broken skin. It can increase your risk of infection. So some things to keep in mind: if you get a bite, if you get an animal bite, a spider bite, or a tick bite between now and surgery, give us a call and let us know. If you shave and you are prone to razor rash, I wouldn't shave the skin around that joint leading up to surgery. We did have a couple patients who got sent home the day of surgery because they had razor rash that was going to interfere with their incision. Patients have gotten canceled for cat scratches, dog scratches that was going to interfere with their incision, for significant sunburns. So be real careful. Keep that skin around the joint that we're going to replace nice and clear, nice and protected. What to bring to the hospital? You can bring your personal hygiene items: toothbrush, toothpaste, deodorant. We'd like you to bring some clothes with you, things that are loose-fitting and comfortable. We want to get you out of the hospital gown and into some regular clothes. You just feel better. You're less exposed. You're more comfortable. We also want you to be in the mindset you're not a sick patient coming to the hospital. You're a well patient. I think getting out of the gown helps with that. And then for shoes, something that will hold onto your foot securely. So we'd prefer no flip-flops. You can bring your battery-powered items, cell phones, tablets. You can bring the power cords for those. But if you have something that's one of a kind or irreplaceable, I wouldn't bring that to the hospital. We also want to let you know about our discharge pharmacy service. So when you're ready to discharge from the hospital, your nurse can send your prescriptions down to the hospital pharmacy. They'll fill the medicine and deliver it to your room before you leave. It's a nice, convenient service. They'll accept your insurance if you have a prescription benefit. You'll need a way to cover your copays though, and the copays at the hospital pharmacy will be very comparable to what you're paying at your regular pharmacy. You'll also need your driver's license or ID for the pain medicine. We would encourage you to use this service if possible. If there are questions or concerns about the prescriptions, we can get all that taken care of and make sure that you have your medicines for home. So all of your surgeries will be done over at JW Ruby Memorial Hospital. The current visitor policy is, for registration, pre-op, surgery, and recovery, you can have one person in the hospital with you. When you get up to your hospital room after the recovery room, the policy is 2 visitors at a time. Regular visiting hours are between 8 a.m. and 7:30 p.m. and we do allow overnight visitation, so you could have one person spend the night with you in your room if you need. When you come onto the campus over at WVU Medicine, it is a great big place. There's 3 hospitals, there's a physician's office center. When you come into the parking lot, we want you to enter the building where it says Main Hospital. Once you get into the lobby, we want you to stop at the information desk, which will be right there on your left as you come through the main doors, and check in at the information desk. Somebody from the information desk will take you and your family up to the Bone and Joint Hospital, which is the 7 Northeast unit, and that's where you'll go through hospital registration. They'll put your family in the waiting room and they'll take you over to the pre-op area and get you ready for surgery. You'll meet your nurse, they'll get your IVs started. If there's lab work that needs to be double checked, they'll take care of that. They'll help you do the final wash on your hip or your knee. The anesthesiologist will be around to finalize your anesthesia plan, and you'll see your surgeon before surgery for any last-minute questions that you might have. So a little information about anesthesia, but you're going to get more of this when you come in for your history and physical visits with the doctors. Currently, the 2 most common types of anesthesia that we're using is either spinal anesthesia or general anesthesia. Spinal anesthesia is where they put medicine into your back that'll make your legs numb. Then they'll give you other medicine and make you go to sleep, so you won't be awake for surgery. They don't have to put the tube down your throat if they do the spinal anesthesia. The other option is to do the general anesthesia, and that's where they'll put you to sleep, and then they slip that tube down your throat, and you'll be on the breathing machine while they're doing the surgery. Not everybody gets the same anesthesia. It's going to be based on what you're having done and your risk factors and your medical history, and a few other factors they'll discuss with you when you come in for your history and physical visits. The surgeons will decide which type of anesthesia will be the best for you. This is the operating room. They'll get you in here and on the table and off to sleep for surgery. It says a catheter may be inserted into the bladder. The guideline for the catheter, for a primary joint replacement, if this is the first time you're having this joint replaced, there's a really good chance they're not going to put a catheter in. If it's a revision or a redo of something that you already have in there, there is a chance that they may put a catheter in. If they use the catheter, it typically goes in after you're asleep in the operating room, should just stay in overnight and come out first thing the next morning. Again, if you have questions about the catheter use, you can discuss that with your doctors and surgeons when you come in for your history and physical visit. After surgery, they'll take you out to the recovery room. You'll be here about 90 minutes or so. They're going to monitor your vital signs. When you are medically ready and your room is ready upstairs, they'll take you up to your hospital room. Sometimes patients hang out in the recovery room longer if they're waiting for a patient upstairs to be discharged and the room to be cleaned up. They'll keep you in the recovery room until your room is ready upstairs. After the recovery room, our plan is to bring you up to the Bone and Joint Hospital. The Bone and Joint Hospital is the name of the orthopedic unit inside of Ruby Memorial. It's up on the 7 Northeast unit if anyone is familiar with the hospital. There are occasions though, should you have a complicated case, if your medical history is more complex, if your surgeon wants to monitor you closer, a higher level of care is always available. So a step-down unit or even to the ICU. This rarely happens, but we want you to know we are going to take care of you at the appropriate level of care. Our plan though is to bring you up to the Bone and Joint Hospital when you're finished in the recovery room. So when you get to your room up on the Bone and Joint Hospital, you may see it written or hear us talk about POD0. That stands for postoperative day 0. That's the day that you had your surgery. The nurses will get you checked in. Somebody from the therapy staff may be around, or someone from the nursing staff may be back around. Our plan is for you to try to get out of bed on the day that you've had your surgery. We've been doing this for many years now. Patients are doing well, getting up and getting moving. It helps wake your body systems up. It decreases your risk of complications. So we'll start with sitting at the edge of the bed. If you're doing well in sitting, we'll get you up on your feet with a walker. If you're doing well in standing, we're going to try to walk a little bit. It may be a few steps up and over to the recliner chair to start. It may be out in the hallway walking around the nursing unit. Some of our patients walk to the rehab gym and practice going up and down steps on the day of surgery. We don't do things that aren't safe. We would never put you or our staff at risk of getting injured, but we do want to get up and get moving on that day of surgery when you're ready. And then wiggling feet and squeezing muscles is part of your blood clot prevention plan, so throughout your recovery, not just on that day of surgery. If your surgeon orders you an incentive spirometer, respiratory therapy will bring that to you and get you set up with that. That's that device in the picture. It helps to exercise your lungs for our patients who may have some respiratory history. In the hospital, you'll see 2 types of therapy. You're going to see both physical therapy and occupational therapy. We both look at how you do getting up and moving around. The difference between us, physical therapy will focus on your walking and exercise. Occupational therapy will focus on your activities of daily living. So making sure you're able to get dressed, that you can get in and out of the shower when you're allowed to do that at home, and that you can get to the bathroom and take care of those tasks. That's the other reason we like you to bring your own clothes. It is much easier for you to practice getting dressed in your own clothes than to use hospital pants and slipper socks. When you come in for your history and physical visits, you're going to meet with our care manager. He's going to check in with your insurance company about your medicines for after surgery, take care of any authorization that needs to happen, and check in on your copays. He's also going to get some information about your home setup and start discussing the discharge process. While you're in the hospital, you'll meet someone from care management as well. They'll come by, we'll finalize your discharge plan, and they are part of the team that helps get you ready to go when your surgeon says you're ready to be discharged. This is a little loose daily schedule over at the hospital. So it says the nurse is going to wake you up at 6 a.m., only if you're asleep. They are in and out of your room every couple of hours. The hospital is a 24-hour-a-day building. The lab comes around at a really early hour of the morning, and some of the surgeons round early as well. The nurses should get you up in the recliner chair in the morning and back to that well patient mentality. We'd like you to be out of the bed and in the chair for breakfast. You may want to get some pain medicine on board when you get up, because you will see physical therapy and occupational therapy in the morning as well. You could get a second session of physical therapy in the afternoon. It'll depend on your plan and when you're going to discharge, but we will make sure you get the therapy you need before you discharge from the hospital. How long are you going to be with us? Could be a few hours after surgery, up to an overnight to 2 overnights. This all depends on what you're having done, what your health history is, and what your discharge plan is. The criteria for discharge: your pain has to be controlled with your pain pills, your vital signs have to be normal, and you have to show us that you're safe. So we want to make sure you can get out of the bed and out of the chair safely. Can you get to the bathroom and get dressed? Are you walking a good distance? That'll get you in your home and around your home. If you have to go up and down steps, we're going to practice that before you leave as well. For therapy when you're discharged, If you go home after your hip replacement, there's a good chance we're not going to require that you do supervised therapy. We want you to walk. Walking's really the best thing you can do after a hip replacement. We would order something for you if we felt like you needed it, but most of our hips are doing well taking care of things on their own. Knee replacement patients almost always need to do supervised therapy. The knee is a different type of joint, so the options for therapy are either outpatient or home health, and that will be discussed more with you when we see you after surgery. For equipment when you're discharged, most of our patients use a front-wheeled walker after surgery. Some of our patients do prefer to have crutches. It doesn't matter to us which device you use, as long as you're safe and we're practicing with that at the hospital. A cane is not going to be enough to start with. We want you to have something two-handed to give you a little bit more support initially. If you have your device already and you are traveling further than an hour from the hospital, or if you think you're going to have to stop on your way home from the hospital, we would advise that you have your device in the car when you come back for surgery. If you have to stop on the way home, we just want to make sure you can get out and move around safely. If you don't have your device already, we can make arrangements for you to get either a front-wheeled walker or a set of crutches before you leave the hospital. The walker usually needs authorized by your insurance, but our care management department will take care of that. We just ask that you be a little patient with us. It takes a little time to get the authorization. And there is an option to have a walker delivered to you at the hospital if you would like. The raised toilet seats and the shower chairs are not usually covered by insurance. They're an out-of-pocket expense. That equipment is mostly a recommendation, not always a requirement. Those things can be picked up at Walmart, at Lowe's or Home Depot, at Menards, at a medical supply store. You can go to your regular pharmacy, CVS, Walgreens. You can order them from a medical supply store. That equipment will run you $25 to $70 on average, depending on what you get and where you get it from. Hi, my name is Shannon and this is Heath, and we are physical therapists here at WVU Medicine's J.W. Ruby Memorial Hospital. We are going to demonstrate the safe way to stand up and sit down from a chair, to walk with a walker, and to go up and down the steps following your total joint replacement. To go sit to stand, you're going to place your surgery leg out in front of you slightly, scoot out to the edge of the chair, and place both hands on the armrest of the chair. Do not place both hands on the walker prior to the stand. You're going to lean forward and push yourself up and reach your hands one at a time for the walker. To sit down, you're going to back up until you feel the chair on the back of your legs. Step your surgery leg out in front of you slightly, then reach one hand back for the armrest and then the other, and lower yourself slowly into the chair. To walk with the walker, you're going to push the walker slightly forward, step with your surgery leg, and then step with your non-surgery leg. As you become more comfortable with the walker, you can begin to normalize your walking pattern. To go up the steps, you're going to place a cane in the hand opposite your handrail. You're going to step up with your non-surgery leg first, and then bring the cane and the surgery leg up to the step. And repeat. To come down the steps, you're going to place a cane in the hand opposite your handrail. You're going to place the cane on the step you're going to and step down with your surgery leg first. And repeat.
Hi, I'm Cynthia Drummond. I'm the orthopedic nurse navigator, and now we're going to talk about all those things that I get worried about. So recognizing and preventing complications. One of those is a DVT, and that stands for deep vein thrombosis or blood clot. Another is a pulmonary embolus, and that's a blood clot that reaches your lungs. We're going to talk about surgical site infections and falls. So first up, let's talk about blood clots. So when patients call me, they're having complaints of pain, swelling, and tenderness in their leg or thigh. Now, this can be to either leg, not just the leg we operate on. After surgery, you guys are going to have pain, of course. You may also notice, though, that you get some bruising, some swelling, and maybe even numbness. All that stuff is normal, and I don't get too concerned about it. I do get concerned when that swelling won't go down when you ice or elevate your leg. That swelling that becomes very painful, tender, red. Patients generally know there is something not right. In your playbooks that you should have received at a previous appointment should have been my business card. On that business card is every single way to get a hold of me, including my pager number. So if it is something that you feel needs me emergently, that is how you can get in touch with me. So let's talk about a pulmonary embolus. Now, a pulmonary embolus is a blood clot that reaches your lungs. If you would start experiencing any of these symptoms, any sudden chest pain, difficulty or rapid breathing, any shortness of breath, sweating, or confusion, I don't want you to call me. I want you calling 911 or getting to your nearest emergency room. A pulmonary embolus can be life-threatening. I need you getting treatment for that rather quickly. So let's talk about preventing a blood clot and what we're going to do to help you prevent that. That is one of the reasons Shannon was telling you about getting you up and getting you moving. Early and frequent walking's absolutely the best thing you can do to help prevent a blood clot. Now, everyone is going to go home on some sort of blood thinner. So that does vary, though, in your health history and what you're having done. You will have a detailed discussion the day of your history and physical when you meet with your surgical and medical teams. We are also going to give you an absolutely gorgeous pair of white, tight compression stockings. Now, believe it or not, this is typically the biggest complaint I get from our patients after their joint replacement is wearing these stockings. I am sure that I have heard every single complaint that there is about them. However, they really do help keep the swelling down out of your legs. So we're going to ask that you wear these to both legs, because remember, I just told you that you can get a blood clot to either leg. So both legs for 4 weeks for 18 hours a day. Now, those 18 hours are totally up to you as to how you want to wear them. But when you leave the bone and joint hospital, please make sure they give you an extra set to go home with. So that way you have a pair to wear and a pair to wash. And when you wash them, don't put them in the dryer. Let them line dry. Let's talk about signs of an infection. So any redness, warmth, pain, swelling, drainage, any fever. Now, the fever that I worry about is 3 days after your surgery and over 100.5. Patients who run fevers those first few days, it's usually because they need to get up and get moving a little bit more, maybe take some bigger deep breaths. But generally that soon after surgery, it is not related to a joint space infection. I do, though, tell patients if at any time there is something that does not look right to you about your incision, I want you to call me. I would much rather we take the time to look at it just to make sure things are okay than you think it's okay and let it go, and then it leads to a joint space infection. Patients who develop joint space infections undergo about 2 more surgeries and about 6 to 8 weeks of IV antibiotics. So we want to do everything possible to prevent that. Also in your book should have been a card that looks like this. Now, this card's got a couple of different purposes. One, it says you have a metal implant. So I want you to fold it and carry it with you. Please write your name and your surgeon's name on there, and that is my phone number, just in case you ever lost the other card. Now, the second, and this is the most important purpose of this card, you will see there are several different procedures listed on that card. Any time for the next 2 years, you are going to have one of those procedures performed. You need an antibiotic before you have that procedure done. Now, this antibiotic is something that we're going to have you take just one time, 1 hour before that scheduled procedure. But again, it is every single time for the next 2 years that you have one of those procedures performed. So what I want you to do, if you're going to have any of those things done, is I want you to call me. That way, just in case we would make changes to this policy, I can let you know that, and then I can call that antibiotic in for you, which I'm happy to do, but I do have one request. Please don't call me on the way to the procedure. If you called me on the way to the procedure, I'm not going to be able to help you because you need to take it an hour before. I'm also going to give you about 3 refills on it. That way, in case something emergent comes up, maybe you break a tooth or lose a filling, maybe you forget to call me, then you've got those extra refills. All right, let's talk about nose and nasal sanitizer. Now, this is something we started using several years ago now, and all this basically is a hand sanitizer for your nose. We probably touch our noses 200 to 300 times a day. We've probably never been more aware of it than we have been over the last several years. We touch our noses a lot. So this medicine you're going to get the day of your surgery when you come to the pre-op area. We're going to show you how to use it because when you leave the bone and joint hospital, please make sure they give this to you to go home with. If we forget to give this to you, it is not something I can call in because pharmacies do not carry it. So then I'm going to need to get it mailed to you from the hospital, and then of course that's going to delay you using it. We're going to ask that you use this for a couple of weeks after your surgery. Now it's very simple to use, and they'll go over this with you again on your discharge. But all you'll do is take that medicine, put it on the end of a Q-tip, and swab the inside of your nose. That's it. It actually smells nice. If you run out of Q-tips that come in that box, please use regular Q-tips. There's nothing special about the Q-tips in that box. All right, let's talk about SMI cold therapy. This is something we have recently started using for our patients. It is a wrap that you may come out of the operating room with, either on your hip or your knee. It will have 2 gel packs in the actual wrap, and then we are going to send you home with an additional 2 gel packs. So what to take home from the hospital? Please remember to take home your nose and nasal sanitizer, your extra compression stockings, some dressing supplies, and the SMI cold therapy wrap with the 4 gel packs.
So dislocation after a hip replacement. It is a potential complication. It's not something that we see a lot of, but we do want you to be aware. Dislocation happens when the ball comes out of the socket. Symptoms will be patients will say that they heard or felt a loud pop. You'll have increased pain in your hip. Your leg may be shortened and rotated. You won't be able to walk on it. It is painful and immobilizing. Should this happen, we want you to page Cindy. Cindy's going to send you to the nearest emergency room, and if that's not Ruby, that's okay. But Cindy's also going to let your surgeon know what's going on. When we see you after surgery, you may have some hip precautions to follow. Some positions we want you to be a little careful, a little cautious about getting into. We have those on a handout that we'll give to you in the hospital. We'll review those with you throughout your hospital stay and make sure that you're safe and comfortable with those. We don't want you to be afraid to move. People aren't walking around and their hip comes out of place. It's usually a fall that gets people into trouble. So a little careful, a little cautious for a few weeks after surgery. Give time for tissues to heal and muscles to get stronger.
Let's talk about falling. As you guys can see from those x-rays, falls can be pretty serious. You can get a fracture or break a bone. You can dislocate that new implant. You can even open up your incision. So it's basically some common sense kind of things. So start thinking about your bathroom, soapy, slippery, wet surfaces. Being outside, walking in your yard, stepping in holes, uneven ground. Always be very mindful where you're stepping. Making sure you got nice clear pathways in your home where you're going to be, free of things like throw rugs, extension cords, things that will cause you to trip while you maneuver through your home with your walker. Watching out for your pets. Our pets are part of our families and they do like to be right where we are. That is generally right under our feet. So just be mindful that they're there. Keeping your cane, walker, or crutches handy gives you some extra stability to hold on to, and then don't be in a rush. Sometimes we get in a rush and trip over our own 2 feet. If you fall after your surgery, I do want to know about it. Your surgeon may want to get an x-ray just to make sure things are where they should be. All right, let's talk about managing your pain at home. We're going to send you home with a pain medicine called roxicodone. It is going to be written for 5 milligram tablets. The directions for this medicine are going to be that you can take 1 to 2 of those every 4 to 6 hours as needed for pain. Hip replacement patients, you guys will get 42 tablets. Knee replacement patients will receive 42 roxicodone, and we would refill for an additional 20 roxicodone if needed. So this is how I need you guys to think about your pain. You're going to have pain, you're having surgery. However, a lot of our patients after surgery do tell me the pain they experience after surgery is much different than that pain you're experiencing now. It's surgical pain. And what I have found is that patients like yourselves that have been dealing with this pain and waiting for your surgery deal with that surgical pain very well. Those first few days, though, at home are going to be your worst. Taking your pain medicine a little bit more scheduled is going to help with that. The farther you get from your surgery date, though, ask yourself, if I use Tylenol, am I going to do okay? If you can say yes, that is absolutely what we want you to do. We want you saving your pain meds for the days you have therapy or maybe at night to help you rest. Just keep in mind that we don't refill that. Now, with all that also being said, we highly recommend taking advantage of our discharge pharmacy service. There has apparently been a nationwide shortage of oxycodone. Our discharge pharmacy assures me they have plenty for our patients to go home with. So we do recommend taking advantage of that service. They're going to bring it to your room. Their prices are great, so it's a great service for our patients. If you are going to use your local pharmacy, please call them up and make sure they have this medicine in stock. If they do not have this medicine and you give them that prescription, then that prescription becomes void. And then we're going to have to figure out how to get you your pain medicine. So keep all that in mind when you're thinking about where you're going to have your medicines for after surgery filled. Let's talk about following up. You should have been given an appointment to follow up with us with your surgical team at 2 weeks following your surgery. We'll then see you again at 6 weeks, 12 weeks, and 1 year from your surgery. Then we'll go 2 years from surgery, then 5 years from surgery, and then we're going to go every 5 years thereafter. Now, this doesn't mean we won't see it any other time. If you're having trouble, all you got to do is give us a call. We'll get you back in here to see your surgeon. I'm going to give you a call the week after your surgery. Shannon or I, neither one of us have had a joint replacement. So it's very easy for us to tell you what to do and when to do it and how you should be feeling, but we have not undergone it. So if things don't go the way we have told you it should go, then I need to know that. Either something happened, something changed, whatever the case may be. I like to see how you're feeling. How's that incision look? How are you doing with your pain meds? You should have every single way to get a hold of me. I am your contact person after surgery if you need something. We also highly recommend taking advantage of our My Chart app. It is a great way to keep in touch with us. It's a great way to send us pictures or ask us questions if there is anything going on with your incision or any other concerns you may have after surgery. If you are interested in signing up for that, please let me know and we can get somebody to help you do that. You may also get a patient survey from the hospital after your discharge. We would appreciate it if you could take a few minutes and fill that out for us. It is a great way that we can kind of make sure we are doing the best possible things that we can do for our patients. So thank you for attending this pre-op education class. If you have any questions, please remember, just give us a call.